to sell because they're super casual and they are able to make their own decisions pretty much apart from the hospital. So cost is a factor for them, but not as much as other places. Obviously an underpad, you're never going to be able to sell but you're not usually going to be able to sell an underpad if it costs more money. But for NICU feeding, you can, not all the time, but again, it's going to be a much more casual environment. You're going to be dealing with like one person, maybe two. So when you want to go there, and we've kind of talked about this, and I'm sure you've seen in your trainings, but you want to talk to like the NICU manager, director, whoever is the highest person that's willing to meet with you, that's a decision maker. And then there might be like some sort of like educator or something along with that. So your initial meeting, you're really just going to be introducing the system. Well, like the spiel I give is, so this is like actually an old extension set, that's weird. But, so the spiel's like, so this system, okay, and again, it depends like what they're moving from, right? So my spiel's gonna be different if they're moving from an orange system, or rather maybe they're currently using a purple system, or they're not using a safe system at all. So that's really gonna depend. So I'm just gonna assume they have some sort of safe system. So what you wanna say is, so this system is very similar to what you guys are used to. So it's comprised of 3 components. So the first is an NG tube, your extension sets, and your syringes. So the way our system works is, actually let me start over. This is gonna be great videos for you guys to watch. So I'll start over.
Wait, let me rewind.
Yeah. So the system consists of 3 components. So you have your NG tubes, your extension sets, and your syringes. And one thing that's very obvious that you're going to notice is that it's purple. So where the purple comes from, there's a big Sentinel alert back in 2006 when JCAHO came out and said, okay, there's too many misconnections. We need something to happen. So they asked us to make a couple changes. They said you need to color coordinate feeding systems. You need engineered controls, and all that's a fancy term for you need to make sure things can't connect to other things that they're not supposed to. And then education. So we feel that the product, we were able to change the color, purple. 90% of the US has adopted purple as their color for feeding. And then engineered controls, we have a safe system, and then you always have me for education if we need it. So the way the system works is with a friction lock. So it's a safe integral connection. This won't connect any IVs, and IVs cannot connect to this. So all you're gonna do is you're gonna take your polyurethane NG tube, your extension set, push it, give it a quarter turn, and just remember that the harder you muscle it in, the harder it is to muscle out, but it's also kind of getting the feel for it. And then hand it over and let them get a feel for it. You also have this bifurcation right here. So what that allows you to do is to deliver medications without having to disconnect anything. So you can keep it as closed of a system as possible. We all know that's kind of important for the babies to expose them to as little as possible. And so what we feel is the bifurcation really allows for that. And the second point is you're going to put the exact same connection together with your syringe. So push, quarter turn. So when you're pulling it apart, make sure you're pulling by the hub, not the tubing or the tether, because those will wear out eventually, but just do the hub, do your reverse quarter turn, and it'll pull straight out. Some things the nurses really like about our feeding tubes that is pointed out to me quite often is the numbers are very clear to read, and they actually don't rub off even if you're using something aggressive like MCT oil. They're really just going to stay there for the full 30 days like they're supposed to. And I'm sure you can feel how soft the polyurethane is. When it warms up, it actually gets soft for the patient's body. So the things you're going to experience are a lot less discomfort for your patient. Typically what we see is babies are crying less when you're putting it in than with other NG tubes. So that's pretty much it for like the presentation side. And then you really just get their thoughts on the system. They would point something out and be like, what's this? Or I don't like that, and explain it to them. And then if it's appropriate, just move to close, like with a trial, like we practice with the PSS role. So I mean, you know, from what you see, I think this is going to be a great fit for your facility. I think that by helping to standardize the entire facility to purple, it's really going to help you guys. So if there ever are those nurses that are floating in from NICU to pediatrics or vice versa, it's really going to make sure that they know that the purple is a safe feeding system, and these are the same connections that every other patient in your hospital is using. So from a safety and risk management standpoint, this is a great system for you guys, and I think we'd be able to trial, blah, blah, blah.
Well done.